Often people come to me with symptoms that they suspect are just a problem under themselves, like a lower backache, headaches, sinusitis, strabismus, which is a wandering of the eye. Young children sometimes have torticollis, wry neck. These are all symptoms of a cranial-sacral system that is out of balance. And as an osteopathic practitioner, what I do is I look for that imbalance in the cranium, the spine, and the sacrum. And when I work on those, the symptoms quite often disappears. Many lower backs I work on, I hardly ever touch the lower back. If you've ever stood in the ocean and had waves moving you back and forth, that rhythmical motion is what an osteopath will actually palpate within the cranium or the skull. In the skull it's the easiest to feel, but that rhythm actually is throughout the entire body. What we focus on is the skull, the cranium, the spine, right down to the sacrum or the tailbone. And what we try to do is balance the motion of the cerebrospinal fluid as well as the energetics of the body. When those energetics and that flow of cerebrospinal fluid is out of balance, large neurological and physiological problems can ensue. For example, if your sacrum or tailbone is out of balance, it will pull the dura, which is the connective tissue that runs right from the spine, the sacrum, right up into the base of the occiput. And when that happens, it starts to pull the occiput out of balance a little bit. Now what's important about that is the cranial nerves, and there's 13 of them, are hugely instrumental in the health of the body. They run directly from the brain to the target organs. They don't go down the spinal cord. And that implies the importance of these nerves. When those nerves exit the skull, they do so through little holes called foramen. And these foramen, for the large part, are not holes singularly in the bone. They are, in fact, two half-moon shapes coming together from two different plates. When these plates in your skull are out of balance or misaligned, those holes then change their diameter. And when this diameter changes, it impedes on those cranial nerves. For example, the vagus nerve, which is one of the more profound nerves of the cranial 13, innervates and looks after a large part of your digestive system. So if somebody has a slight distortion in their occiput, they then start, they don't of course feel this, what they do feel though is their digestive system starting to falter. They start getting, if it's an infant, they'll have colic. If they're an adult, they'll start developing a hiatal hernia. They'll start having indigestion, constipation. What the osteopathic practitioners try to do is balance out the cranium, and keeping in mind that we have an innate wisdom within our being that always seeks balance. So it's not like I'm manipulating these bones, I'm actually just suggesting to them where the balance is. And out of that wisdom within the body, the balance is found. It's very, very subtle work. It's very gentle work. And for the most part, people receiving an osteopathic treatment won't even really feel what I'm doing, other than a profound sense of relaxation comes over the body. And in that relaxation is when the body really starts to heal.